My name is Patience Muyambo. I head up research and insights for Kasi Insight. And I'll be co-presenting with our founder, who's also the head of our data and economic intelligence, and that's Yannick Lefang. So just to give you a brief overview of who we are, just quickly, in terms of who Kasi Insights, we a market research company. We're Africa's leading provider with regards to data, indicators, and insights. So what we're trying to do is understand the opinions and attitudes and behaviors of ordinary Africans. And the difference between us and most of the other market research companies is that each month we conduct our own proprietary research, where we conduct surveys amongst ordinary Africans, and we turn this into actionable insights that we provide on our data portal, which is a self-service platform where our clients can come in and leverage this platform to get consumer insights at scale. So some of our data products have been used by leading global financial data and companies and across Africa and global corporations. Okay. So with regards to the data and analytics capability that we have, historically, only large corporates or large companies could afford to conduct market research or to access market research. And we've tried to provide access to any company by utilizing innovative research methods, which make our research really very affordable. So even startups and SMEs can access our data and our insights. Our philosophy is to provide companies with timely and reliable data from Africa. And previously, a lot of companies had challenges with accessing reliable data from Africa that's consistent. So we survey across 8 different markets, and we've built quite a huge data set over 5 years. So for the last 5 years, we've been conducting our own proprietary research, month in, month out, and this will help our clients to stay ahead and to understand the evolving consumer needs. To date, within that proprietary data set, we have over 150,000 survey interviews that have been conducted with more than 1,000 questions and over 50 brands and categories that we've done across countries like Nigeria, South Africa, Kenya, Ghana, Cameroon, Tanzania, Ivory Coast, and Ethiopia, which is one of the latest countries that we added to our data set. We have questions across all different types of categories. So we have retail, media, personal care, food and beverage, finance, digital, looking at mobile, and tourism. So we've a number of data sets that we provide to our clients. One of our most popular ones is around economic intelligence. That's our consumer sentiment. We have data sets on health and wellness. We have data sets around financing, which is credit and lending. And we now have the COVID-19 data set as well. Just to get a bit of context around COVID-19 in Africa, just as a summary. So we currently have about just under 70,000 confirmed coronavirus cases in Africa. The leading countries with the highest number of infections is Egypt and South Africa, that have over 10,000 cases. But despite the government's early containment efforts to kind of curb the spread of the virus across the continent, we're seeing that a lot of countries have been infected. In fact, only one country, which is Lesotho, does not have coronavirus cases to date. But every country has been, affected to different extents, and the numbers are, the numbers could be a reflection of the testing capability. We know that Egypt and South Africa have had the highest volume of coronavirus tests. So this could be the reason why they have the highest volume of cases being reported as well. And then with regards to our survey, the COVID-19 Pulse, so this survey is primarily to test the impact of the coronavirus on Africans, and as well tracking their behavior and sentiment. We started this survey, as I said, in February of 2020, and just on the onset of the virus, and that's when I think that's when we first had our first case in Africa, in Egypt, and we've been conducting this survey monthly ever since. We conduct this monthly, and we conduct about 3,700 interviews across 8 countries, which are the 8 countries that we usually survey. And we publish the findings in a free monthly report. And we also have these, the results of the data available on our consumer portal. My colleague will take us through those results in detail on the portal. So just in terms of a summary of the findings that the research findings. So to date, we're finding that more and more Africans are becoming very concerned about the COVID-19 situation. The numbers are increasing. And what we're seeing is, in previous reports and previous surveys, we saw that the Africans were more concerned about their livelihood, so their finances, and this was a major concern. However, we're seeing that more and more people are becoming fearful of getting infected by the virus. So as more and more people are testing positive for the virus, and it's becoming a reality in their communities, the major concern is actually shifting from being an economic concern to being a health concern as well. We're seeing that African governments are starting to ease the level of restrictions. In our last report, most of the countries were on lockdown, and now they've kind of started, allowing certain businesses to operate. However, people are still sheltering in place. A lot of people are still in self-isolation, and border restrictions are still in place. So there are still challenges with regards to people being sheltered in place. We're seeing that a lot of consumers are citing that their lifestyles have been impacted as they continue to practice social distancing measures. And we're also seeing that there's changes in category shopping behavior. So Yannick will go into detail around how people are shopping, where they're shopping, what consumer demand is in terms of where they're shopping more of particular categories and which categories they're shopping less of. And this varies across the countries as well as across different categories. And then lastly, brands must retain the messaging efforts. So one of the key things that we're seeing is that the brands that are maintaining that are maintaining communication and engagement, where they are actually managing to retain consumer engagement, and they're reaping results from the messaging efforts, and they're staying ahead of the curve in terms of retaining their sales and actually winning customers over. One of the interesting findings from our research is that COVID-19 has become some form of a global equalizer. So as Cassie, we've been tracking consumer sentiments with our own proprietary data for the last 5 years. And we're seeing that for the very first time in our data set, we're seeing the convergence of the US and Africa sentiment. The US has always been very positive. But because of the COVID-19, we saw a sharp drop in March and in April, which signals a slowdown in consumer spending across all markets globally. So this is a very interesting, we've indicated where the first COVID-19 case was. So I'll push this over to my colleague, Yannick, to take you through the findings in detail. And he's going to be using our data portal to just show you the results.
Thank you, Patience, for the introduction. So what we've done, as Patience mentions, is put together this COVID data set and put it on our data portal. And what we want to show you now is really the framework that we've used since February in helping brands and businesses understand the impact of COVID-19 when it comes to the African markets and the African consumer. So, and what we, if you think about our framework at a high level, we start by looking at consumer sentiment, because we've been tracking consumer sentiment for the past 4.5 years. And we saw in early February signs of change in consumer sentiment. And so from there, we looked at the impact of COVID, how concerned were people about COVID, and what were some of the changes that resulted from COVID-19. So what you're going to see here is basically that whole framework, and using our data portal. So again, piggyback on what Patience mentioned. So starting with consumer sentiment, right? And again, we saw, and this is the global consumer sentiment that's tracking consumer sentiment in the seven countries that we follow. So we saw a big drop of consumer sentiment around February and March, and the latest data is actually showing us that after the sharp drop in March, we have we continue to see depressed consumer sentiment to a lesser extent than what we saw in March, but consumer sentiment continues to be depressed in Africa. And so if you think about specific markets or the big markets in Africa, if you take South Africa, for example, as you can see, South Africa, along with the African trend, has also seen a significant drop in consumer sentiment. And as you can see, even before COVID-19 hit the continent, South Africa was already trending around zero, which means that consumer sentiment was already muted, and the country was already in a very difficult economic situation. So we know now that South Africa, for example, is in a recession, and that will have an impact, of course, in terms of consumer habits, consumer purchasing, and so on and so forth. So looking at then consumer sentiment, we moved on to the COVID itself. So what does that mean with that context when it comes to COVID? And so we looked at what we call the fear index, which was, okay, how concerned are people about COVID? And what you see here basically is the result of the data that we've been collecting since February. So as you can see, 5 is very concerned, 1 is not concerned at all. So you can see 4 and 5, we have over 67% of the respondent saying that they're very concerned with COVID-19. And so definitely, there is a fear factor when it comes to COVID-19. And if you want to look at this, from a month-over-month perspective and see how this has changed, you can see that since February, we've seen, if you look at the blue and the orange bar, they've increased month over month. And as Patience mentioned earlier, the number of cases of COVID-19 has increased significantly over the past 3 months. And as a result, we see that month over month, there is an increase in terms of how concerned people are with COVID-19. Now, what are people concerned about? And so when you look at the concern, what are some of the changes, or what are some of the concerns? So we saw that people are mostly concerned about their livelihood, so struggling financially, not making enough money to provide for their family. So when you think about the context, again, looking back at what we saw with our consumer sentiment, you have a situation where the African economies are already, I think, in a very difficult economic situation, and now, combined with a health crisis, people are basically first concerned about their livelihood. But as you can see, things are changing. So if you look at, again, the trend month over month, we can see that in March, it was the concerns were mostly around, struggling financially, having enough money to provide for their family, and slowly, as the crisis and the pandemic becomes a reality on the continent, we now see a higher proportion of people being concerned about being infected by the disease. So, for example, one of my family contracting the disease, was 18% in March. It's now 20%. You have, for example, getting infected. Myself, you got 15% of the respondents that were concerned about that. It's now 19%. So we can definitely see that, the crisis is definitely evolving. It's changing weekly, monthly, and that is reflected, in the consumer attitude as well. So when it comes to, if you think about health, infection rate, infection likelihood, for example. So when we ask people about whether they know somebody or they've been personally diagnosed with coronavirus, we still have a very low percentage of people that are saying, yes, which is reflective of the overall COVID data. So we are about 16%. And then if you look, month over month as well, we can see that, we were at 7% roughly in March. We're now up at 9%. So that percentage is actually increasing, which again is a reflection of how the virus is evolving. So looking at, the likelihood of being infected. So how likely do you think that someone will be infected? And that would obviously depend on what are some of the measures, social distancing measures, curfew measures that the governments are taking to prevent the spread of the disease. So we can see that overall, we have about 41% of the respondents that are saying they're likely to be infected. And when we look at the month-over-month trend, again, we're seeing, if you're looking at the green bar and then the red bar, there are some changes also, so month over month. Now, looking at, where do people find the highest risk of being infected? So obviously, using public transportation comes first. And as we saw in our previous webinar, unlike the Western, economies where social distancing, working from home became a big thing, in Africa, due to the economic conditions and the informality of the economies, working from home is not, it's not an option for many of these people. So definitely, using public transportation is where people feel that there's a risk of being infected. Then you have being at the mall, at the store, and then hospital. Then we looked at, so this is really the health state, if you want.